Hi, I'm Susan Crowell with My Autism Ally, and we are here with Partners in Autism to discuss the new Indiana Medicaid requirements and rumored changes. So we're going to get the answers to your most pressing questions by breaking down the impact this will have on our community and ABA.
What is the state's rationale for these cuts? Are they part of a broader budget reductions?
So the state is concerned about the rising cost and need for ABA therapy, and while trying to make sure they use taxpayer money in efficient ways, they are planning to make drastic changes to ABA. It is clear that these changes are not the answer to the budget issues and will have long-term and harmful effects to our children and community.
But I'm concerned that this really doesn't save the money that they think it does. I sit here and I'm like, these kids are all going to go somewhere else. It's not like that we're going to limit this at 3 years for ABA and then there's no funds that ever have to follow that kid anywhere else. They're going to need to be in public education. But maybe what concerns me more about that is how that impacts families in a very pinched financial way. All of a sudden, a single mom who was working full time and maybe had a job with benefits and was able to manage it all on her own. Well, now if ABA is going to be capped and her kid's going to be gone, she may have to apply for public assistance. We may have families that all of a sudden somebody's got to stay home because school doesn't go year round. So the alternatives and the struggles that our families are going to face the dollars are still going to have to be spent on kids. And beyond that, I'm a big sayer because my kid's 23. You either invest today when they're little, or we're going to pay a fortune when these kids age out and when they're adults. So you need to decide what we are trying to create the most independent adult we can possibly have. And that is an adult, in some cases, that may be able to go into the workforce and contribute by paying taxes. Some of our kiddos are not going to be able to do that, but some with the proper support will be able to do that. And so I'm just concerned that legislators are looking at a specific number in the budget and going, that is too big, we have to make that go down. And although I can understand that perspective, you're just taking that money from one pile and you're going to be taking money and putting it in other piles.
Meanwhile, all of these children just lost their services. They now don't have the skill set to go into school. They don't have the skill set to function at home. They don't have those daily living skills. And that's another thing. Our children, sometimes maybe they're an 8-year-old, but their academic level is kindergarten or lower, and they're going to put them in a classroom with other 8-year-olds. So what is that, second grade? So they're going to put them in a second grade classroom, and essentially we now have to wait for our children to fail and then get an IEP and then get into the appropriate environment. And so you can see the domino effect here.
Yes. Do we have any idea when these changes are going to take effect?
So like I mentioned before, the MPI numbers and background checks, that was the first requirement. I believe the date was April 1st. Everybody has to have this done, and then everything actually has to be submitted on the Medicaid provider portal. So we have to go in, we have to create a whole new process, get all these documents ready. They also are having these provider attestation forms. So if you get an MPI number, you have to then attest to the services that you're providing. So we have to upload everything, create them as providers in the Medicaid portal, which for large companies, that's going to be a huge, massive time constraint for them to get that done in time. So April 1st is, I believe that's the first one. And then the one that obviously is most concerning to families is that 30-hour week, 3-year cap. If that bill gets pushed through, then they are saying as of April 1st is when they are going to be immediately cutting those hours and immediately counting those authorizations that the families have already had.